Turn next tonight on this Live 2020 to Europe, to Italy, because health officials in this country are studying what they're seeing there, what they're seeing in France. We heard that from Dr. Fauci earlier. In Italy, in fact, they have more doctors and more hospital beds per capita than what we have even right here in the U.S. So we'll drill down on that as well. And tonight, the Vatican now revealing a bishop who recently met with the Pope has now tested positive. Tonight, at least 349 deaths reported in just the last 24 hours in Italy alone. The images are haunting. You've seen them. France, Spain, and Germany now locking down their countries. And ABC's James Longman tonight from London.
Italy has now had nearly 28,000 cases, with more than 2,100 deaths. And as the toll surges across the continent, Europe is now the epicenter of the COVID-19 crisis.
More cases are now being reported every day than were reported in China at the highest of its epidemic.
And now Italy's health service, one of the best in the world, is overwhelmed.
Now we are starting to discharge many patients, and this is very good, but as soon as we discharge a patient, we receive another one.
New admissions seen in tents outside hospitals to stop the spread inside. Thousands now fighting for their lives and their dignity.
We are almost at the same level as an emergency ward,
says nurse Alberto Poinelli at this tent hospital in Brescia. He says the main issue is the fear in patients who test positive, having to calm them, reassure them, and give them a plan they can trust. There can be no funerals in Italy, only names in the paper. Pages and pages of obituaries for those claimed by corona. The dead laid to rest unaccompanied, their mourning families, some of them millions, still stuck at home. But Italy may have acted too late, and perhaps not strongly enough at first. South Korea was hit around the same time, but has recorded just 75 deaths. Europe holds its breath to avoid infection, today issuing a 30-day ban on all non-essential travel to the EU. The European effort, though, is not coordinated. But America's closest ally, Britain, slower than others, only today advising people to stay home.
We need people to start working from home where they possibly can.
World Health Organization advice is more direct.
Not quarantine alone, not social distancing alone, do it all.
Back in Italy, Easter services disrupted. The Pope's solo vigil offering up prayers on behalf of millions. And every night, tributes are laid down for their frontline heroes.
We lit up candles every night. We want to pay an invisible but strong homage to all the doctors and nurses that are constantly working to help us here.
Just incredible images from overseas, and we're going to continue to follow that and bring back in Dr. Jen Ashton, who's with us. And we were talking about this on World News Tonight, just the numbers when you compare with Italy. And take a look at these numbers at home, because in Italy, they actually have more doctors per person there than we have here in the U.S. 4 per 1,000 in Italy versus 2.6 per 1,000 here at home. Then when it comes to hospital beds, they have more hospital beds per capita than we do, 34 for every 10,000 people there. Here in the U.S., we have about 29 beds per 10,000 people. Jen, authorities have been saying that when it comes to what you're seeing in Italy and what you're seeing in France, that they're about 2 weeks ahead of the wave that we'll see here. So what does that tell you?
Well, that's exactly why you're hearing Dr. Fauci say, we are behind. We have to take aggressive steps now so that down the road someone can say we've done too much. Really, time is of the essence when you're dealing with a virus like this. The other interesting thing, David, about Italy in particular, they have a different culture and society and style of living than we do. They tend to have multi-generations living together with a lot of contact, and they tend to have an older population, and I think that's why you're seeing some of the severity there.
Yeah, the cultural norms. It's just heartbreaking when you hear that they can't have funerals. They're just doing announcements in the newspaper there because they're in the throes of such a horrible, horrible moment in their nation's history. I want to bring in Dr. Vinayak Kumar, because what many viewers at home don't realize is that we have a medical team that helps to support Dr. Jen on the air every single day here. And one of the things that we saw from over the weekend, when you hear that we're 2 weeks behind what we're seeing in France and Italy, is the social distancing and the lack thereof. We saw a lot of people out celebrating, of course, St. Patrick's, which I have done before, but not this weekend because of the guidelines that have been put out there. And also the beaches, for example, for spring break, they've now closed down some of those beaches. But would that have made a difference if we were able to get the word out and tell people, really, we have something coming. We're just 2 weeks behind what we're seeing in Europe?
Oh, yeah, absolutely. The key thing to keep in mind is that a lot of these young folks, they might think themselves as invulnerable, but as we talked about earlier, these guys can totally be asymptomatic. So you might be very close to a person who's asymptomatic and spread the disease amongst the youth. And more importantly, this is a public health concern. So those youth can actually infect the elderly, causing higher mortality rates.
Dr. Kumar, that's an excellent point. Think about our older generation. We have to protect them at the same time. And Jen, do we have any idea, because we've seen this question on Twitter as well, how many people one person can infect, what the data tells us so far?
We don't, but we know that the doubling time or the transmission dynamics of this is significant, and that basically every 7 days the number of cases doubles. So that is, again, why the clock is ticking, and these aggressive social distancing measures need to be put into action right now.
Which is why Dr. Fauci said we're in a race against the virus here in the U.S. All right, Jen, thanks.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.